All right, man, it's recording.
Okay. This article is titled "Face Transplant for Virginia Man is Lauded as the Most Extensive in History." And this is from about a month back, where University of Maryland did a very extensive face transplant. And I actually printed posters for this press brief. Oh, and I was manning the cameras next to ABC for the hospital. So, Richard Norris was 22 when a gun accident took his lips, his nose, and the front portion of his tongue. The damage to his jaw left him with limited mouth mobility and gave the appearance that his face had sunken into itself. The doctors at the University of Maryland Medical Center said. For 15 years, Norris of Hillsvale, Virginia, hid behind a surgical mask. He avoided eating in public and shopped for groceries at night. He lived as a recluse, according to doctors, not a functioning member of society. Last week, Norris, 37, underwent a 38-hour surgery lauded as the most extensive face transplant in history. 3 days later, he looked in a mirror. He had a nose, he could move his tongue, and he would no longer need a mask. And the doctor said he couldn't stop repeating over and over, "This is so cool." The operation, which took place March 19th and 20th at Maryland Shock Trauma Center, was Baltimore's hospital's first full face transplant. It included replacing the tongue, the teeth, and the upper and lower jaws, basically from here up and around. All of that. 5 other patients received a heart, both lungs, a liver, and a kidney from the same donor. Officials said the operation was the culmination of a decade's worth of research funded by the Office of Naval Research as a part of an effort to expand facial reconstruction possibilities for troops injured by makeshift bombs. Norris, a civilian, was chosen as the first transplant candidate after meeting Eduardo Rodriguez, a dentist and surgeon at UMMC, in 2005. Norris had numerous operations in the years after his accident, first to save his life and then to make his face somewhat functional, but he wanted more. His research led him to Rodriguez, known for his experience with facial reconstruction. I remember he drove up here from Virginia one Saturday, and I could see there were some things we could improve with conventional surgery, functional things like putting food in his mouth, Rodriguez said in an interview Tuesday. But there are certain parts of his body we could never recreate, for example, his lips. Norris had 12 more surgeries to regain additional mobility in his face and mouth and to reconstruct some of his features, but Rodriguez and his team hit a wall. The next logical step was facial transplantation, Rodriguez said. Norris consented to the clinical trial and began a rigorous evaluation that included physical and psychological exams. He had to wait for the right donor, the perfect donor, according to Rodriguez. On March 17th, Rodriguez received a call telling him about a potential match. By 7 p.m. that Sunday, the match was confirmed. Norris rolled into the operating room Monday morning. The results of countless team meetings, conference calls, and practice on cadavers were put to the test during the marathon surgery. Everything went off without a hitch, Rodriguez said, of the procedure, which involved more than 150 doctors, nurses, and UMMC staff members. It was just a beautiful event. Norris was kept on a ventilator overnight. Doctors lightened the sedation after 24 hours. By day 3, Norris asked for a mirror. He is one of the few victims of ballistic injury to the face who retained vision, and he wanted to see himself. 1 week later, doctors said he is able to shave his face and brush his teeth. Despite what doctors have characterized as remarkable progress, recovery will take Norris, who was not made available for an interview, several months. As with any organ transplant, there's a risk of rejection. Norris is expected to remain in the hospital for 1 month and stay in Baltimore under observation for 3 months. A lot of people may think this is all cosmetic, Rodriguez says, but for someone who has lived behind a mask, if you call it living, he has his life back. He's a strong man again.
There you go. Thank you very much, Mr. Carl.